One Brooklyn Health, and we're all out today, not only to celebrate this beautiful weather, but to celebrate the health of Brooklyn. And so we have staff who are out to share information about the healthcare services that are provided by One Brooklyn Health, by Brookdale, by Interfaith, by Kingsbrook, and all of our ambulatory care centers. We've got folks who are doing high blood pressure screenings. We got staff who are talking about new parents and providing services to new families. We have staff talking about dental services and nutrition and mental health, mental wellness. So we have a whole group of committed staff out here celebrating Brooklyn, celebrating our community, and wanting to make sure that our community knows what we have to offer. We have a bone and joint program. We have a bariatrics program. We have orthopedics. We have cardiology. We have a full range of services from birth to geriatric services for all parts of one's body, because our belief is that we have to offer services to keep everyone healthy and everyone having, and their families being healthy. We also provide maternal and child health services. And again, our system includes Interfaith Medical Center, Brookdale Hospital, Kingsbrook Medical Center, and we have at least 10 ambulatory care centers, including Bishop Walker, which is in this neighborhood. And we also provide a full range of dental services. And many people have problems getting access to dental health. And we provide a very strong range of services for children, adolescents, and adults in terms of dental services. It's important that our community knows that they can stay in Brooklyn, because everything that is being offered outside of this borough is available within Brooklyn. And it's important for our communities to use Brooklyn hospitals so that we can continue to thrive. And we have, as I said, we have cardiology services, we have cancer services, we have bone and joint treatment services, we have physical therapy, and a full range of orthopedic services. So don't go over the bridge. First figure out in One Brooklyn, if we have the services, it's available to you. If we don't show that we have the volume or the use by the people in the community, then our funders, the state, the federal government, would believe that there is no need for services in Central Brooklyn. So we need our communities to use our Central Brooklyn hospitals and health centers, because the more they use us, the more resources we can get, and the more we can expand the service offerings that we can provide.
Hello, my name is Laquan Castro, also known as DJ Authorized. I'm here at the health fair, just having a good time, man, making sure everybody getting their health, getting their checkup, and listening to good music at the same time, man. It's very important because it's not given it to us, especially not in our community. So for us to get this, to have this available to all the community, is very important to have.
Hi, good afternoon, and it's happy springtime. My name is Debbie Bowen, and I live in Crown Heights, and I came today because I am very excited that Brookdale, Kingsbrook, and Interfaith have merged. That way we don't lose any hospital. We keep our nurses and doctors, and then we can get advancement for all of the disciplines for us, the people who need the care in our neighborhood.
My name is Cordell Mercier. I am a Kingsbrook Jewish OBH registered assistant nurse manager of the ER, and we are here at this festivity to help share the knowledge of blood pressure and the importance of getting screened. This is our table here. This is Ms. Johnson, and we're here just to give information out to our community, how important it is to make sure you screen yourself, understand that diet, as well as medication, your history is a large part of why you may have to make sure your blood pressure is under control at every given time. Blood pressure is really much a very serious issue. A lot of people in our communities do not know they have blood pressure issues because you know why? You don't have the symptoms. And this is why you must check your blood pressure, because you will not know you have a blood pressure concern if you don't get it checked. It is a silent killer that can cause strokes, infarcts of the brain, and this is why you must be vigilant and you must get your blood pressure checked. The symptoms of stroke are very, very, very serious, and they can range from losing one vision on one side of the eye all the way to losing one function of another side of the body. There are so many things that you need to be aware about stroke, and because it's so fragile and can be affected so easily by a high blood pressure, it is truly, truly even a stronger reason to have your blood pressure monitored on a regular basis. And stroke symptoms can vary from anything from the upper extremity to the unilateral parts of the body. Well, blood pressure does not discriminate. Blood pressure does not discriminate against anybody's size. And believe it or not, even, there's really popular in our culture, but it's also popular in many other cultures. And your size is not the factor that can make you want to get your blood pressure checked. It is about how strong your heart is, how much resistance you have in your peripheral vessels. These are the factors that can increase your blood pressure. So size is not the issue. Your blood pressure is really a reflection of your life and how you live and your genetics. I want to say what's up to OBH, Kingsbrook, OBH, Brookdale, and also Interfaith. Thanks for your services, everybody. Thank you.
Letitia James, and what's up, New York? So we're here today. We're having a wonderful health fair, which is sponsored by our wonderful Congress member, Hakeem Jeffries. My name is Letitia James. I'm the Attorney General of the state of New York, and I'm wearing my Easter hat today because we also had an Easter parade as well. We gave out a number of presents to children. They had an Easter egg hunt. It was fabulous. So there's 2 events we're sponsoring this afternoon at Restoration. And I just wanted to tell everyone to have a blessed holiday tomorrow. We're celebrating Ramadan and Easter and Passover all on the same day. We're all coming together. We got to stop the violence. God bless you and thank you. And what's up?
And I came out here today to support our local Brooklyn One hospital conglomeration to see what our health system is doing for our community, what we as a community can do to make sure that we get the best health care, and just to partake in the fellowship, the friendship, the information that's provided, resources that's available to us, and to just be out in all this gorgeous weather. We suffer a lot with diabetes, high blood pressure, cholesterol, and elevated levels, and they're out here with all that information. Our local officials are out here supporting that, encouraging us, telling us what we can do as a community to make sure we get the services we need.
So out here today, we were just educating patients about their different disease states. We were doing blood pressure screenings. We were also giving out pill boxes for medication organization. And we were also just counseling patients on any questions they had about any of their medications.
Really a pleasure to be out there to help serve the community. And my name is Patricia, like my colleague said. So some of the patients really came out with questions about their blood pressure. Some of them want to get off the medication. But I believe the issue is really educating the patient as to why they're taking the medication, what is high blood pressure, and if it's not under control, what is the consequences of having a high blood pressure that's not controlled. So it's very important to educate our community in knowing how to manage the medication. My passion has always been to help people. Way back in St. Lucia, I also worked as a pharmacist back then. And I came here just to also be involved in pharmacy. I believe I play a very important role in helping people of my own nationality, my own culture, to help them and to educate them, because we are plagued with so many chronic illnesses such as diabetes, hypertension, heart failure. So it's very important to educate them and to have them have better control over the chronic conditions.
Hi, I'm Katie. I'm a registered dietitian at Interfaith Medical Center, and I'm here telling people about nutrition, giving out recipes, and enjoying the day. It's important that we're out here telling people about nutrition, telling them how to take control of their health. Nutrition is incredibly important. It's, we have to eat multiple times a day. You have to eat to survive. What you put in your body matters, and it can really make or break your health.
My name is Malaika Clark, and I'm here to support the health fair sponsored by Congressman Hakeem Jeffrey and other elected officials of my community. I think it's important since it's taxpayers' money, and to know we have our congressman who cares about us and who understands the need in the community to give back and at least meet what is priority, such as health care and supplies for health care, which many of us are not, we cannot afford, especially when we go to our PC, our primary care provider, the money, the funds are back in the community. Compliments or thank God for Congressman Hakeem Jeffries and our elected officials that we have here serving us in Bed-Stuy, Brooklyn.
Hello and happy Saturday, Bed-Stuy. How you doing out there? This is the One Brooklyn Health family. Each and every one of you are a part of this system because we benefit from the health care that these stellar providers give to us. So give them a round of applause for being here today to make sure that our community is whole. To Lorraine Brown, who is the head of the One Brooklyn Health Center. But we're going to give it up for our Congressman Hakeem Jeffries for bringing us all together today. It's Holy Week, but we're going to be holy about our health because we need to do what we need to do for this community to heal and move forward into the next decade. I want to just say that we heard you in the New York State Assembly and Senate. This year we were able to secure records amount of funding for mental health care. Give it up for mental health care. Newborn home visiting programs. Long-term care for our elders. We are investing in the physical plants of our hospitals. This week, we were all over at Interfaith so that we could cut the ribbon on the new Behavioral Health Center, which is a much-needed addition to our community to treat mental health and substance abuse.
My name is Chi Osei, and I'm the council member for the 36th Councilmanic District. I want to commend One Brooklyn Health, our Congress member, our state assembly member for all of their advocacy and initiatives through pushing for the funding that we need to take care of ourselves. Yes, these past 2 years have been rough and we are still moving out of this pandemic, but there are so many other diseases and health issues that impact our community. So to be out here to organize those that are professionals and are able to provide us with the resources that we need to take care of ourselves is something that I am just commending our elected officials on bringing to this neighborhood. As your council member, we are in the budget dance right now. It is always my duty to advocate for the resources that this community deserves, especially pertaining to the health and healthcare, as well as accessibility to healthcare for Black people. So just know that that is a lot of what my advocacy and work within the council is doing. My office is right upstairs, so if you need help in knowing where to access the resources that are at hand given to this community, please come up to our office. We're there 5 days a week from 10 a.m. to 6 p.m. And then also, we are always providing resources on a weekly basis at our Wellness Wednesdays right here at Restoration Plaza from 11 to 1 p.m.
To acknowledge our district manager for Community Board 3, Mr. Henry Butler. Our district leader, Ms. Kenesha Cooper. And the executive director for One Brooklyn Health at Brookdale Hospital, Dr. Sandra Scott. And now, without further ado, I would like to bring up the CEO for One Brooklyn Health, Ms. Lorraine Brown.
I'm going to call somebody out because I was speaking to Ms. Bowen, and she said, it's a wonderful thing. One Brooklyn has come together and brought Brookdale and Interfaith and Kingsbrook and all of your health centers together, and these hospitals were closing. These hospitals were, dying, but you all have a system now, and people can stay in Brooklyn. They can stay in Brooklyn and get all of the health care services they need, because we have wonderful physicians, wonderful nurses, wonderful staff throughout all disciplines who care, who live in this community. And so we need you all to not only come out to the health fairs, but if you don't have a doctor, come to One Brooklyn. We are your family and we will serve you. So without further ado, I think the man of the hour is here. And I would like to introduce Congressman Jeffries, but he doesn't need any introductions. But what I do want to say is we know we have a fighter in Washington. You know you have someone who always has your back. And in healthcare and in all aspects of government. You know, I told my son I was coming to this event today, and I told him I was going to meet with Congressman Jeffries, and he lives in New Jersey. He's not a constituent. He said, "Oh my God, you're going to meet with Hakeem Jeffries?" I said, "Yes." So, Hakeem Jeffries, it goes beyond this district, because in fact you are a national hero. You're a national hero, and we want to make sure that you remain not only of Brooklyn, and not only for Brooklyn, but frankly for this country. So thank you very much, Congressmember Jeffries.
Good afternoon, everybody. So good to be here, and certainly thankful for Lorraine Brown. She's the best healthcare network CEO this side of heaven. We're blessed to have her here leading the charge with One Brooklyn Health. So many amazing things have happened in our community under her leadership, and of course to my colleagues in government, Assemblywoman Zinnerman and Chi Osei, our council member who's off to a great start. They are tremendous community partners with me, city, state, and federal, in trying to make sure that we continue to deliver for our community, to our district leaders who have been acknowledged, also stalwart civic leaders in this community, and to each and every one of you. I'm just so thankful that you have come out today for this health fair to celebrate what One Brooklyn Health really means for our community. Often it is the case that the communities that need the most in terms of healthcare resources get the least. Like communities here in central Brooklyn that tend to suffer disproportionately from some of the highest rates of ailment, whether that's diabetes or heart disease, respiratory illness, certain forms of cancer, and other ailments that plague our community. And so collectively, we're going to continue to lean in to making sure that One Brooklyn Health has all of the resources necessary to provide high quality, first-rate health care at Interfaith, at Brookdale, at Kingsbrook, and with our community partners. Thankful for the presence of so many of you today at this healthcare fair. So without further ado, I just wanted to present some resources that we were able to secure for some of the community health initiatives being led in such an extraordinary way by Lorraine Brown and others. This is my 5th term in the Congress, my 10th year, and when I arrived in Congress, they took away the ability for members of Congress to fight for resource allocations specific to community-based organizations. And thankfully, under the leadership of our Speaker and Leader Schumer and President Biden, this year, for the first time, the ability to fund and provide resources for community project funding has been brought back. And I was determined to make sure that there were resources that were brought back right here to Bedford-Stuyvesant and right here to One Brooklyn Health and its related partners. So I'm proud to present 2 checks to Lorraine, which she'll accept on behalf of the community. One is for $1 million for the One Brooklyn Health System, Interfaith, Brookdale Hospitals to 2022 community project funding. United States government, Representative Hakeem Jeffries. That's me, y'all. Who's that? But this was. That's $1 million. And then the second is a related partnership that goes to Brooklyn Communities Collaborative, an effort that has been spearheaded by someone who we stand on the shoulders of as elected officials, former Assemblyman Roger Green, in partnership with SEIU 1199 and One Brooklyn Health. And Yvette Clark and I worked together on this particular project funding initiative where we secured $875,000 to the Brooklyn Communities Collaborative. And We're just getting started. And so, Lorraine?
And also board member of One Brooklyn to stand here with us.
That's right. Now,
That's $1 million in your hand. It ain't lotto.
the money is good, I promise you that, but just don't go to the bank with this particular check.
$1 million for Interfaith in Brookdale will go for things like EKG machines, right? People come in with cardiac conditions and they don't even know, and so sometimes we need to diagnose. But also to go for furnishings in our outpatient settings for bariatric patients, because it's embarrassing when someone comes in and they're on a chair or their table and they don't fit. And so we want to be respectful. But there also, this $1 million will also go for other types of diagnostic equipment at our facilities. Because we are facilities that, we don't have a lot of money like some of the hospitals across the bridge. We don't have money to replace equipment the way it should be. So sometimes, as my mother would say, we make a way. But we make a way by having equipment that is at the end of life, but we still use it because we must. So these dollars will help us replenish important medical equipment and furnishings. Now, the $875,000 for Community Collaborative of Brooklyn is amazing. One of the things you must know, and I know many of you know this, is sometimes you have a health condition where you have to go to multiple places. Not everything is provided at one location. And sometimes it may not even be provided by the same hospital. But part of the Community Collaborative is a partnership with federally qualified health centers, with Maimonides, they're in another part of Brooklyn, but they're still family, and SUNY, the University Hospital. So if a person comes to One Brooklyn and they need something that we can provide, we say, brothers and sisters at SUNY, you have this service. We're going to refer this patient. This money is to create an information system so that when a patient goes from one place to the next, they don't have to tell their story. The information will be in the system, and we'll be able to make referrals in a seamless way. That is our near future. We have much more to do, but what our Congress member has provided us is with that down payment for us to do more and better and partner with others to make sure that we're providing all of the health services that you and your families, our community needs. So thank you very much, Congressman.
Thank you again, Lorraine, for that breakdown, for your leadership. And if you don't know, now you know what the money's going to be used for. The music. Enjoy the rest of the health fair. Hakeem Jeffries, Congressman for the 8th Congressional District, including right here in Bedford-Stuyvesant. It was an honor to work with my partner and colleague, Congresswoman Yvette Clarke, to secure approximately $2 million in funding for One Brooklyn Health, that's Interfaith and Kingsbrook and Brookdale, as well as the Brooklyn Community Collaboratives Initiative, which works to holistically improve the healthcare outcomes and conditions of the people who live in Central Brooklyn. And we were successful in securing this funding. It's just a down payment in making sure that we can transform healthcare here in Central Brooklyn for the people that we are privileged to serve. Well, Lorraine Brown has been a tremendous CEO of One Brooklyn Health, and we have the utmost confidence in her ability to take the resources that we have secured from the federal government and put them to the greatest possible use. And so it was important for CEO Brown to detail what exactly this funding, $1.875 million, is going to be used for in terms of those individuals, the least, the lost, and the left behind, the poor, the sick, and the afflicted here in Central Brooklyn.
One Brooklyn Health received $664 million in 2017 from New York State for the replacement of outdated facilities for our 3 hospitals, for information technology, for ambulatory care services. One of the projects that was funded through that $664 million grant was the new psychiatric inpatient unit that was referred to. We're going to totally renovate all of our inpatient psychiatric services. We have 3 more units to go. We're going to renovate our medical surgical inpatient units at Interfaith. We're going to redo completely an emergency department, expanding its size, making sure we have separate spaces for children, for adults, and for people who have mental health issues. We are actually doing things that I like to say people won't see, but they can feel, because we're replacing air conditioning systems, electrical systems, all things for safety that as a hospital that has not had the capital resources, we've not been able to upgrade these important infrastructure systems. We're replacing elevators. You can only imagine how important an elevator is to a hospital, of getting people to where they need to go, staff, food, medications. We're partnering with community-based mental health and healthcare providers to expand outpatient primary care services. We're also replacing our inpatient services intensive care unit at Brookdale. That project has been finished, and we went from an open ward to individual rooms, state-of-the-art intensive care. We're doing an emergency room renovation at Brookdale. We're improving our operating rooms. We're adding new spaces in community sites where housing is being developed, and we're going to be providing health care in those buildings. So this is a major multi-year program, and we're grateful for the state's investment in our capital program. Not for staff, it's for capital, physical improvements. It costs a lot to provide health care services. It costs even more to keep the infrastructure safe and stable. And so this grant that we received was a recognition that our hospitals had not been invested in, that our communities had not been invested in. And so this is an investment for the future of healthcare. And frankly, we're going for more. We're going to apply for more grants because our communities deserve it, and they deserve to be getting care in modern, respectful spaces that are safe and that are state-of-the-art.
My name is Henry Butler, District Manager for Brooklyn Community Board 3, Bedford-Stuyvesant. Out here to support my hospital, Interfaith Hospital, and support all the services that they are delivering to our community of Bed-Stuy, North Crown Heights, and Central Brooklyn. I know Interfaith when they were struggling. I was here when they were trying to close it, and they've come all the way back, and they have so many new services for our community that we need, and so I'm just so proud of them. So I will give them an A+ for everything they are doing right now for this community. So the money that was received today is for services for the residents of Central Brooklyn. Yes, it's correct. A lot of times monies go for salaries, but not the money that was given today by Congressman Jeffries. This is for direct services for the community. Listen, we know the health numbers are not good for Central Brooklyn, but this is something that will make those numbers much better for our community.
Hi everyone, my name is Shadina Dews. I'm from Healthy Families Brookdale. We're a part of the home visiting program. We stay with the family for 5 years. We have a huge referral base. So of course the families that come in that are eligible for our program will get all the awesome services that we have. And the services that we do provide is either no cost at all or low cost. If you have any questions, please give me a call. Again, my name is Shadina Dews. I'm from the Healthy Families Brookdale program. We're over by Brookdale Hospital. That's our home base. But most of our services are outside the Brookdale Hospital. Services that we do provide is parent-child activities surrounding parent-child interaction. Of course, we provide services, referrals such as public assistance, SNAP, housing, advocacy, definitely other services, whether you need a mommy and me group or other services such as SNAP or Pampers or baby supplies. That's what we do provide. Part of the benefits that we do provide is that a worker will be with you that help you through that transition of motherhood. And of course, we stay with you until the baby is 5 years old. So we do a lot of services, in-home services, and as well in person, and then of course virtually. So we do work such as ages and stages questionnaire. So we want to make sure that the baby is on point when it comes to any issues of the milestone, childhood milestones. So of course, we want to be as early, we want to detect early intervention as possible if there's any delays with the baby. That is why we, Healthy Families, do provide services in certain zip codes because the infant mortality is very high. So of course, we provide information such as child development, such as nutrition. Of course, we provide social services, and we do a lot of interaction one-on-one with mom. So we don't only service mom and the baby, but as well we service the father.
Hi, my name is Donna Yearwood. I'm a patient navigator from the bariatrics department at Brookdale Hospital. What we do is we do obesity. We help patients who are obese, either through surgery or medicine, weight loss treatment. We have different locations where we see patients. So at any time you could give the hospital a call and we'd be willing to set up an appointment for you. So it's very important to be out here today in the community because we're reaching out to people who are out here who might not be able to actually go to a doctor, but at least we're the first contact. And once we see them here at our table, we'll be able to set up an appointment and get them started on the program. So we have more than one location, but you're able to reach us at 718-240-8446 or 718-240-5346.
Hey, my name is Simone Henry. I'm the practice manager of the orthopedic department at One Brooklyn Health, the Brookdale campus. And it's a pleasure for me to be out here today in the community to share with the community what we do have to offer for them. We are based on Rockaway Parkway and Linden Boulevard. Our address is 1235 Linden Boulevard, actually. Quite convenient across the street from Brookdale's main entrance. We do take pride in taking care of our patients and enhancing the experience that you would have when coming to see one of our orthopedic providers. We do provide pediatric orthopedics, adult geriatric orthopedics, and also sports medicine. For all you fit guys out there who might have a little, ink or glitch within your ankles, we can take care of that. However, you're always welcome to come in to see us. Again, we're located 1235 Linden Boulevard, lower level of the urgent care building. We do have quite experienced physicians, one experienced in sports medicine. We also have quite seasoned physicians experienced in both lower and upper joint replacements. And we have a very well-renowned doctor, Dr. Colin Woon, who is our hip and reconstruction surgeon, who has made quite a mark on our community with reconstructing and getting a lot of our people back up and going as to their daily regular activities with less pain. In the event you would ever like to come and have this experience with our bone and joint, so if you feel the need to, you may give us a call at 718-240-ORTHO. That's 718-240-6784. 718-240-ORTHO.
Good afternoon. I'm here attending the One Brooklyn Health Fair. I'm part of One Brooklyn. I'm Brooklyn Buzz. It's a glorious day to know all about what's going on here during this COVID and after COVID. So it was good for the kids as well as adults. So we're wrapping up right now. We had a great day. I'm Stan Parham of Brooklyn Buzz.
My name is Dr. Harsh Kanamala. I'm a second-year resident at Brookdale Hospital of One Brooklyn Health. I have my colleague next to me, Dr. Ahmed Solomon. He's one of our chief residents that we have here. We're here today to do blood pressure screenings for kids, talk to kids about poisoning, talk to kids about car seats, safety around dogs, safety in the public. So that's what we're here to do today. We feel like we provide a vital service to the community. We're one of the biggest hospitals in East Brooklyn, if not the only one. We take care of thousands of children from newborns to 18 years old, even sometimes up to 21 years old.
I believe like prevention is better than treatment. So if you give health education about the basic things for the parents and anticipatory guidance for the parents, this will help a lot in preventing a lot of accidents, a lot of like diseases that they can come to the community. Like also we are here at the dental department. If you speak about how to prevent caries, like this will prevent a lot of dental issues for children. So that's why like we are here today to educate parents about how to prevent a lot of diseases, how to prevent a lot of accidents. So I would like to give an example about like how to prevent obesity, and obesity gives a lot of complications in the future, like having diabetes or like having heart diseases. So educating parents about the healthy diet, we have like some also materials about healthy diet. So this helps like prevent this in the future, and obesity now is a big like it's a second pandemic now. So we are trying to help prevent this as well. So usually we do outreach events. Like during the COVID, definitely that it stopped for a lot of the time, but now we are coming back, like doing like at least like 1 or 2 per month to reach to the parents, to reach to the community. So to help them to educate and to give them the opportunity to ask questions. So we can answer these questions even like right here inside the in the public.
Yes, certainly this is Reverend Terry Lee and Dr. Lee and Joyce Lee, and we're here, supporting One Brooklyn Health. Of course, Sharon Devilish Leeds, is a mentor, and she's one of the person that really helped make this happen. And we're here to support her on her endeavor. And of course, we live across from Brookdale, and my daughter was given birth just a few days ago. Our daughter,
Amen.
right?
Amen.
At Brookdale.
Yes.
And how was it?
It was wonderful. They treat her very good, and they attended to her as soon as possible. As she get in, she get the help, and it was amazing to see how they responded to her. And I really appreciate the work that they're doing up at Brookdale Hospital.
Hi, my name is Kima Hibber, and I'm a filmmaker based in Brooklyn. I'm working on a short film now, and today I'm at this fair. It's the health fair in downtown Brooklyn, in Bed-Stuy rather, and it's beautiful out today. It's very important to have HIV screening, blood pressure tests, and a lot of other services for the black community in Bed-Stuy. I think it's necessary, and it's a good step. I think right now young people are very afraid of COVID. And so COVID testing and making sure that is super accessible is very important. And I think community services for younger black people, especially in high school and middle school, are really important too.